Marianne, I'm hoping from a Twitter perspective, what do you see happening in Twitter when it comes to patients trying to connect?
And so I'm new to Twitter, 3 months, so I can't speak to everything that's happening in Twitter, but I will say this. In general, much to some of the earlier points, I think people are so interested in a like experience, right? So I happen to be very passionate about this. My mother was diagnosed with MS in 1981 when, a support group meant getting in a car, having somebody drive you to a group that was probably, we lived in suburbia, like 45 minutes away, and when you have limited mobility, and no internet, right? It's nearly impossible to have that kind of experience where you have a group of people. So I think what social media has done is let people really make these connections, and people who are going through an experience are very passionate about talking about it and sharing it, and sharing their treatment options and their experiences with doctors and medications. And so what we do see at Twitter are these patient communities that have sprung up, and they are very public. And I think it's a little bit counterintuitive. People always thought a lot of these situations were very private. And when I was at Google, we saw it at YouTube as well, where there were these grassroots groups talking about things like bariatric surgery, which people thought was so personal and embarrassing and no one would want to talk about it, but everybody did want to talk about it. So whether you're new to a diagnosis and you're looking and searching for that information and that connection that will help you, or you're living with your diagnosis and you're trying to connect with other people to share your experience, it's just unbelievable how valuable that is. And we're seeing data now just showing how it really impacts outcome and will completely change healthcare. And it's also changing the relationship that patients have with their doctors in a really positive way.